morning. This is Dr. Thornley. I'm a neurologist specializing in epilepsy, and today I'm going to go over the legalities and technicalities of medical marijuana. So medical marijuana at low doses is non-intoxicating. It's used in a lot of medical problems, including epilepsy, pain. It's used in Parkinson's disease, multiple sclerosis. So one of the questions I frequently get asked about is the process. And in the state of Florida, it takes about 2 months to obtain a medical marijuana ID card because it's still illegal to obtain it. And if you have possession of it, you can get arrested. When I was taking my qualifying course, I'm subject to being questioned by the FBI. But regardless, the surging popularity of medical marijuana makes it well known that we use it for medical purposes. So in Florida, I'm just going to walk you through. You need to be seen by a qualified physician, meaning they took a course saying that they understand the ramifications, they understand the conditions where patients may benefit from medical marijuana. So when you meet the criteria, then you are deemed an appropriate candidate. And then you fill out paperwork. There's a consent form which is required, and then you need a passport size ID you can get at the pharmacy, and then fill it out. The physician will register you that way. The government knows who is registered for this, and they keep track of that. So it's a way of making sure that one patient is under the care of one physician only. So it takes care of the fact that some patients may be doctor hopping and you're under the care of one physician because as it stands, it's still a Category 1 medication. Physicians are not allowed to prescribe it, they can only recommend it. So after the paperwork is done, then when your ID arrives, it can also be done online, and currently as of April 2, there's about 90,000 registrants. New registrants about 2,000 per month, and there's about 1,200 physicians who are qualified to do this. So it's about a 2-month waiting period. And when you get your card, you call the dispensary of your choice. Going over that, there's only 7 dispensaries in the whole of Florida, meaning these have met the strict guidelines. They're regulated. They've been in the nursery business for at least 30 years. And they meet high quality, which is why their products are very pricey. And that's because all their products are organic, meaning there's nothing artificial, no artificial ingredients, no cutting agents, no flavors. So it's all natural. And you don't have to worry about mold. So I always encourage patients to visit the dispensary at least once because it's going to be very overwhelming. And I'll go over all the different products and the ratios because the information can be very overwhelming. So when you get your card, you call the dispensary of your choice. They will call your doctor's office, and then your doctor's office will give the orders, the recommendations, and then the pharmacy will give you a call back. And that's about it. All right, so this is part 2 of my medical marijuana series. And then next time we'll go over all the different ratios, also different diseases, and then because it can be very overwhelming. All we know right now is the popular stigma of its recreational uses, but very little is known about the medical uses. And even when patients come, they're actually surprised that you can be treated with medical marijuana without the side effects of intoxication. And that's a very big stigma that I'm trying to educate the public on, patients, including physicians, that it doesn't give any rise to tolerance. You don't need a higher level to achieve the same effect. Cannabidiol is non-intoxicating. You don't get euphoria. Low doses of THC is also non-intoxicating. So these are stigmas that we need to overcome in the fear of prescribing this. Okay, all right. Tune in next time. And this is Dr. Thornley signing off.